Identify the chemotherapeutic agent. A. Furosemide. B. Levofloxacin. C. Lamotrigine. D. Methotrexate. E. Gabapentin. The answer is D. Methotrexate. Methotrexate is a chemotherapeutic agent. Levofloxacin is an antibiotic, lamotrigine is a mood stabilizer, gabapentin is an anti-epileptic agent, and furosemide is a diuretic. The oncology nurse cares for a patient receiving internal radiation treatment for cancer. Which of the following scenarios most concerns the nurse? A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. B. The patient complains about remaining on bed rest and asks to stand up. C. The nursing student stands away from the patient while talking to him. D. The charge nurse asks providers if they are pregnant before assigning them to this patient's care. E. The physician performs a physical assessment for 10 minutes. The answer is A. The nursing assistant provides care in the patient's room for 2 hours during the 8-hour shift. When caring for a patient receiving internal radiation, the length of exposure to the radiation is a high priority for the nurse. It is important to rotate staff who care for the patient, limiting close contact to 30 minutes per 8-hour shift. Additionally, it is important to organize tasks so limited time is spent in the client's room. Visitors must also be limited. Pregnant women should not be assigned to work with this client. The patient must be on bed rest while sealed sources of radiation are placed. It is also important not to stand close to the radioactive source. Which of the following is not a proven risk factor for the development of oral cancer? A. Excessive alcohol consumption. B. Human papillomavirus, HPV. C. Regular use of alcohol-containing mouthwash. D. Tobacco product use. E. A diet with inadequate amounts of fruits and vegetables. The answer is C. Regular use of alcohol-containing mouthwash. All of the above are proven risk factors with the exception of mouthwash use. Poor dental care, prolonged present irritation, such as excessive flossing, tobacco and alcohol abuse, infection with certain strains of HPV, and an unbalanced diet can increase the risk of oral cancer. Which leukemia is linked to the Philadelphia chromosome? A. Chronic myelogenous leukemia, CML. B. Chronic lymphocytic leukemia, CLL. C. Acute myelogenous leukemia, AML. D. Acute lymphocytic leukemia, ALL. The answer is A. Chronic myelogenous leukemia, CML. The Philadelphia chromosome, which is an abnormality in chromosome 22, is most often found in bone marrow cells of patients with chronic myelogenous leukemia. It may also occasionally be found in acute lymphocytic leukemia, though this is rare. Reed-Sternberg cells are pathognomonic in what type of cancer? A. Non-Hodgkin's lymphoma. B. Acute myeloblastic leukemia. C. Acute lymphocytic leukemia. D. Hodgkin's lymphoma. The answer is D. Hodgkin's lymphoma. Reed-Sternberg cells are the pathognomonic cells of Hodgkin's lymphoma. These are mutated multinucleated B cells with a large amount of cytoplasm. These cells can be present in other pathologies. The diagnosis of Hodgkin's lymphoma can only be made if the Reed-Sternberg cells are in the presence of non-neoplastic inflammatory cells such as lymphocytes, plasma cells, and eosinophils.